Guys, welcome back to the channel. So we have started with mesenchymal origin or odontogenic tumor, in which we have started with odontogenic myxoma. We have seen that it is thought to be the dental papilla, the primitive dental pearl, and female is more commonly affected, and both the jaws are equally affected. Multilocular होता है mainly and gives honeycomb appearance, and it is from odontogenic mesenchyme. Today we'll be dealing with the treatment plan of this tumor. Okay, let's start. Treatment: curative treatment, resection with 1.0 to 1.5 centimeter bony margin and one uninvolved anatomical barrier margin. Palliation may be achieved with enucleation and curettage, but recurrence chances is more because it is unencapsulated. It is not a encapsulated tumor. It is unencapsulated. So palliative treatment, that means enucleation and curettage, will lead to recurrence of this tumor. So we'll mainly go for curative treatment with resection and one uninvolved anatomical margin. Palliative debulking procedure is also done when tumor is completely unresectable. जब ट्यूमर को हम किसी भी तरीके से रिसेक्ट नहीं कर पा रहे या सर्जिकली नहीं कर पा रहे, then we'll go for palliative debulking procedure. Now coming to second tumor of mesenchymal origin is cemetoblastoma. This is hematomatous proliferation of cementoblasts forming disorganized cementum around the apical one half of a tooth root. Okay, this is very important. Like cementoblastoma जो disorganized cementum बनाता है, it is at the apical one half of a tooth root. It is present apically and at the one half, like last half of the tooth root. Okay, cementoblastoma is a hard expansion in a premolar or molar region of either jaw. Means it is also can be seen in maxilla and mandible. दोनों में देख सकते हैं हार्ड एक्सपेंशन, बस मैंडिबल इट इज मोर कॉमनली अफेक्टेड इन सीमेंटोब्लास्टोमा. ओके. Frequent deep dull pain associated with expansion. It causes dull pain. Okay. The overlying mucosa is intact and the associated teeth are not mobile. In cementoblastoma, the teeth are not mobile and the overlying mucosa is completely intact. Mandible is more commonly affected than maxilla. Teenagers and young adults, that is less than 30 years of age, mostly mandibular first molar. In mandible also, first molar is more commonly affected, and male is more commonly affected than female. In odontogenic myxoma, females are more commonly affected, but in cementoblastoma, male are more commonly affected. Okay. Now coming radiographically shows a spherical radio-opaque mass. It is a radio-opaque mass encompassing and essentially representing the apical half of the tooth root. We have seen that it replaces the apical one half of the tooth root. Okay, it is the radio-opaque spherical mass. Obliterates the outline of the root's apical half instead. There is a characteristic radiolucent margin around the mass, giving the impression of periodontal membrane space, and the tooth is vital. Mostly the tooth is vital, and around the radio-opaque thing, there is a radiolucent margin around the mass, around the radio-opaque mass. It gives the impression of periodontal membrane space. The lesion arises from cellular cementum. It produces a disorganized and vascular cementum that seems to recapitulate a periodontal membrane like encapsulation. Okay. Now, what are the differential diagnoses? Osteoblastoma, ossifying fibroma, condensing osteitis, and hypercementosis. Diagnostic workup and treatment: removal of the associated tooth with the lesion attached. The resultant bone cavity may be grafted to restore the full alveolus and is closed at the mucosal level. Okay, for this cavity, graft can be used, and newer generation material like bone morphogenic protein, acellular collagen, all these can be used in when cementoblastoma along with tooth is removed. A long-term resorbable membrane can be given, or a permanent membrane can be placed over the buccal cortical opening to inhibit fibrous tissue ingrowth. fibrous tissue ingrowth नहीं हो इसलिए हम लोग एक resorbable membrane दे देते हैं या permanent membrane दे देते हैं over the buccal cortical opening. Okay, this is all for today. Now we'll dealing the histopath in the next class and starting with the next tumor. Till then, like, share, subscribe and comment. Bye.